some couple things that I do with in the clinic. So patient comes in, they have non-specific anterior shoulder pain, and with that, your assessment leads you down to a couple things. It could be long head of the bicep tendon, short head of the bicep tendon, just parascapular pain, paradeltoid pain, lateral arm pain. Either way, whatever the assessment leads you down to, that is your assessment. Well, one of the things I found in the last couple of years to really stimulate or facilitate that assessment would be the diagnostic ultrasound. That diagnostic musculoskeletal ultrasound really helps us as physiotherapists, as movement specialists, as musculoskeletal practitioners, especially in the outpatient orthopedic world, is that we get to diagnose our patients and really facilitate that diagnosis in real time by stressing those tendons and stressing that soft tissue, really. And so patient comes in, they have non-specific shoulder pain, and so you do an exam. So some of the images that I have here up on the screen are of shoulder images. Now, I would not expect anyone here to be able to identify what exactly it is that is being seen, because if you are not trained in it, this is not as easy as reading an MRI or a CT scan, which is really quite simple to read. And if anyone is interested in learning diagnostic ultrasound, I highly encourage you to do it, but I will say this, it is not for the faint of heart. It is not easy to learn at first glance. You have to really know your cross-sectional anatomy, really know your anatomy in general, but it's not like reading an MRI or a CT scan or even a X-ray or radiograph, because those are just incredibly easy to read for at least face value. Now, I'm not talking about diagnosing, some multi-stage, tumor or anything like that, but just from a standpoint of, is there a tear, is there not a tear, and go from there. Obviously, with experience, you'll get better at these things. But so one of the images that comes up, so all of these are shoulder images. Again, I just put into Google, typed in shoulder ultrasound, pulled the images. These are the first images that shows up. So patient comes in, and one of the most common scans you'll do in a shoulder exam, you have complete exams and incomplete exams. A complete exam is where you basically look at all of the tissues, the soft tissues and hard tissues throughout the shoulder, and then you bill for a complete exam. And then if you wanted to look at just one specific tissue, then you would bill for an incomplete. Now, for Medicare in my area at the time of this recording, I think it pays for a complete exam pays around $120, which is kind of, it's good at face value, but it kind of stinks because about 2 years ago we were getting about $148 an exam, and so they are severely cutting rates for ultrasound imaging very quickly. So but nonetheless, this probably exam takes me about 5 minutes to do from start to finish for a complete exam, not including the time to document what is going on with the patients or even review it with the patients, but to just physically perform the exam. Then it takes me about 5 minutes. And again, that occurs with with just practice. Now, again, I do shoulder exams, probably the most, by far and few, is the most common exam I do. Now, if this were an ankle exam, I'd probably fumble through it because I haven't done them in a while. However, so, just let me just pull up this image, because here's an easy image to go through. So as we see here, you've got the probe is on the shoulder, and then we're looking for these images right here. And so essentially this white line right here, this heterogeneous hyperechogenicity right here, what we're looking for is, this is bone. Okay, so this is your intertubercular sulcus, or your bicipital groove, and what we're looking for is a nice convex, a nice depressed cave there, so that we have a nice deep groove for our bicep tendon to reside within. And then next we are going to look for the bicep tendon in itself. Okay, it should kind of look like a bundle of spaghetti, in a ball. And then we're going to have that. Above that, superficial to that, is we're going to have the transverse humeral ligament. That way we can encapsulate and hold that tendon within that bicipital groove. Deltoid muscles, subcutaneous tissue and fat and skin, which is going to be superficial to that. Now, just as an FYI, anytime you read an image for any of these images go from superficial or surface value to deep to the bone. Typically, once we get to bone, we don't have any image beneath it, because the ultrasound waves are not strong enough to penetrate through the bone, that they reverberate too much and it no longer gives us a quality image, so they just stop at the bone. And so there's a grayscale image here, but there's really nothing below this area here. Like you can see over here, when we're looking at infraspinous fossa, the humeral head. Nothing down below here, and that's okay because there's nothing below these bony areas. So this is just bone. Even if it's a hollow bone, you're not going to see anything beneath it. So just to give you an idea, so what I have my probe out here that I use in the clinic. So I've had this probe for, like I said, a couple years, and so we have this is a linear probe, which is used most commonly for musculoskeletal ultrasound. And so there we go. So this linear probe actually has a little bit of a smaller footprint, which is the kind of the length of the side of the probe, but it works either way. And so essentially, another thing to kind of think about, which no one talks about, is, I don't know if you can see here in the image, but there's a little lip here. So you can kind of see that, whereas the other side does not. And that is not like, a lot of people think that that's like to help guide you, to give you an area to hold. It's not. It's actually to give you an indication of which is going to be superficial, or what side of the screen you're looking at when you're looking at the screen, because very quickly it can get confusing. For me, the way I trained, the way I'd learned, is I basically always keep this, this nodule, this lip is always going to be to the right or superficial. So if you're, in a coronal view, so essentially if I were to do a shoulder exam, let's pull this down a little bit. If I were to do a shoulder exam, we've got this guy pointing to the right. This is my right shoulder, and I would be doing it here. If I'm going to look at the long head bicep tendon in a long axis view, then I would rotate it so that this guy is pointing upward. And every time, so I never am going to have this thing pointing downward. I'm never going to have this thing pointing to the left. And so the biggest common thing is patients will do, or clinicians will do in the beginning, which technically isn't wrong, you just have to make sure you identify your image correctly, is they'll start with this guy on the right, and they'll always remember the image with this guy being outer or laterally. And by doing so, they'll do this, and then they'll flip the probe. Notice I flipped the probe and do it to the other side, as opposed to holding it here, holding nice and strong, and it's angled this way so you can hold it real close, give it some pressure, and then let go. Notice I did not rotate the probe at all, and then boom. So now this is pointing technically medially, but it's just to give me the same form of the image. So you're always going to be pointing right, you may always be pointing left, whichever way you do, that is technically the correct way to do it. So either way, that image would be just like the probe shows right here, that image is going to be just shown right here. And so what I wanted to do is just show a quick, brief view. So I'm using Complete Anatomy. I love this software, just to kind of show you how it looks, because I think a lot of people get really confused of how, and notice, and we go back here for a second, there's not much image being seen. I mean, the only image that you can see is whatever the size of this footprint is. I mean, that's all you get. So if you want to see more of the tendon, you're going to have to go up and down. If you're in a short axis view, which just means you're going this way, or a long axis view, if you want to kind of trace the whole tendon going down. That would be, of course, if you're going with the bicep tendon, and you can do that with every single tendon, every single muscle, every single nerve, soft tissue you want to go through. But anyway, so going through here, I just wanted to kind of show you. So this, by the way, is a little bit easier to do on an iPad. So let me see if I can line this up the way I want. So notice that we have here, we have our bicipital groove, and so let's see if I can line this up the way I want it to be. So the image that you're gonna see is like this. So we're gonna have here the lesser tuberosity, the intertubercular sulcus, or the bicipital groove, the greater tuberosity. The bicep tendon is going to sit within there. Let me see if I can kind of pull it up without making the muscles get in the way. Okay, so you can kind of see where the tendon would have been. So that image you're seeing is just that rope. Okay, so that's just, we're cutting there. Then of course we would have the connective tissue, the transverse humeral ligament there. So that was the bicep tendon sheath. Let me see if we can add it. I think that was added right there. Yep. So so right there, bicep tendon sheath there, and the transverse humeral ligament. And so essentially, that would what we would be looking at with that image. And then, we are going to have the muscles above. So you're going to have that subscapularis tendon, that's going to be residing medially or laterally, depending on which way you have your probe set. But that's why it's important to know to kind of locate and designate your image so that you can kind of give yourself a focal point. And then you're going to have the deltoid, which is cut so that you can provide this image to show you real quick. You're going to have the deltoid, subcutaneous tissue, subcu, and fat and skin. So that is going to be kind of what that image looks like. So again, here, lesser tuberosity, lesser tubercle, intertubercular sulcus, greater tube, and then we're going to have that bicep tendon sitting in that bicipital groove there. And so, just again to kind of show you that image is what we're looking at. That should be able to, hopefully that makes a little bit more sense what we're looking at. So here's that groove. See this swelling over here? That's not actually swelling. That's your subscapularis tendon coming in here. It's not the best of images, but the guy is muscular, so it kind of gets in the way. Here we do have biceps tendon sitting right there. Again, you can see the bicep tendon, the nice circle oval thing going on. This ligament right here is going to be that transverse humeral ligament holding it within the placement, and then we're going to have all this nice steak meaty red muscle above, which is going to be the deltoid. So if you have any questions, please feel free to reach out. If not, hopefully you enjoyed this and you can kind of see how diagnostic ultrasound can really be an adjunct to your practice. If you have any questions, feel free to reach out, like this comment, subscribe if you haven't already done so. Thank you so much.